Quality concerns shut down a major manufacturer last fall, and some hospitals have exhausted their supplies. But this afternoon, we've learned the FDA has reached an agreement with 2 other companies to release more methotrexate by the end of the week. CBS 11's Robbie Owens found one North Texas family who credits that drug with saving their son's life.
Can I do the drill now? Vibrant, almost 2-year-old, full of energy, and he looks and acts normal.
You wouldn't know from just looking at him, but this handsome, busy toddler
Papi
has leukemia.
It was very frightening.
Bennett has undergone intense chemotherapy, and Mom Kirsa says he is now in remission, thanks in part to a drug called methotrexate.
It's not only put him in remission, but that's what's going to keep the cancer from coming back.
But there's a problem. This life-saving cancer drug is now in critically short supply.
I think everyone is still taking precautions.
Dr. Naomi Winnick, a nationally known expert on pediatric leukemia, says hospital staff will make scheduling adjustments to use their stock of methotrexate more efficiently until additional supplies arrive.
Because we're now going to make sure that we have enough patients so that if we open a 1,000 milligram vial, that everyone who's supposed to get methotrexate is there and ready so that we don't throw out anything.
With Bennett in remission, Mom Kirsa has gone from worrying about the cancer to wondering if there'll be enough methotrexate to treat it.
We shouldn't be having this conversation, you know? This shouldn't happen. Childhood leukemia is curable, and it's because of methotrexate. It plays a huge role.
In Dallas, Robbie Owens, CBS 11 News.
No Children's Medical Center patients have missed any of their doses. Methotrexate is used to treat other cancers as well.
Today, 2 North Texas hospitals took a big step to help save lives. Children's Medical Center and UT Southwestern are creating a new research center to fight pediatric cancer. NBC5's Ben Russell is in Dallas with the details.
Although the work done here on the campus of UT Southwestern will be done on a very grand scale on the 11th floor of a newly unveiled laboratory of this UT Southwestern building, the actual work they will do is on the small scale, microscopic stem cells. And we're told the questions they will answer here are questions others couldn't even conceive of. Dr. Sean Morrison is the leader of the research team here at UT Southwestern in this joint effort with Dallas Children's Medical Center. He's an innovator in the field of stem cell research, and he will lead a team of what will become 150 doctors and staff at the Heyman Laboratory for Stem Cell and Cancer Biology. These 2 hospitals are teaming up to create this new laboratory, and the name of the lab implies what type of work they will be doing. Cutting-edge research into how stem cells can influence, among other areas, the development of cancer cells and birth defects.
This is about a cross-dimensional pursuit of bringing multiple people from multiple different scientific subspecialties together that are asking and answering questions that could not even be contemplated without the support that we're providing to create the Research Institute.
You have an opportunity to make a difference when you work on the questions that are not obvious or the problems that other people consider too difficult. So we're trying to make transformational changes here, not incremental changes.
All of this work is possible in part due to a $10 million donation to Children's Medical Center by the Heyman Charitable Foundation, and that is the second largest ever single donation to this now 100-year-old facility.
Tomorrow, the 2nd season of the original dramatic series Children's Med Dallas debuts right here on WFAA at 6:30 p.m. Now, the show features emotionally compelling stories about physicians, nurses, expert caregivers, and patients' families from Children's Medical Center. And today I'm here with Dr. Christine Gulasarian. She's a heart surgeon at Children's Medical Center and one of the doctors featured on the show. How cool. How are you, doctor?
I am fine, thank you. Thanks for having me this morning.
Let's talk about Children's Med Dallas. This has got to be a very stressful process of kind of what we're peeking in on, a real-life story.
You know, it really is. The show is actually meant to be a documentary to let viewers in on what we do every day and really get a glimpse into our patients' lives and the struggles that they face, whether they're in the hospital for days, weeks, or even months.
Okay, so this is season 2. So how will this be a little bit different or vamped up from season 1?
Well, in season 2, I don't know if any of the viewers had the chance to see season 1, but we're going to be starting off with the conclusion of one of the stories following one of my patients, a little girl named Rylan, who was waiting for a heart transplant. And one unique thing about this documentary is that we didn't film knowing what the end was going to be.
Right.
And so we left with a bit of a cliffhanger. So the season 2 is going to start off with the conclusion of Rylan's story.
Wow.
But you're going to be introduced to a whole host of new areas within the hospital, the cancer management, the neonatal intensive care unit, and the emergency room, which is always an exciting place.
I'm sure. And it's just real life. You never know how it's going to unfold from day to day and what content you're going to receive when it's reality like that.
Exactly. And then, you know, just like in the first series, you're going to see a glimpse of the physicians at work, but also a little glimpse of their personal lives at home, and you know, you'll have some surprises there too. So I think it's going to be a great second season.
It sounds like it. Well, a lot of people I bet don't realize that Children's is a not-for-profit hospital. What does that mean, and how can viewers help? And I'm sure this television series sheds light to that.
Sure. Yeah, I really do think that a lot of people are in the dark about this, and when you look at the numbers, 1 in every 5 children in the Dallas area and 1 in every 4 children in the Legacy area are supported by Children's Medical Center. But more than half of them need some kind of financial support because their families can't do it. So contributions from people around the area are really helpful for these families. And it also helps us as physicians to be able to give the care that we do and also learn new things and advance our research so that we can help a lot of these kids with their chronic illnesses.
Yeah, okay. So if people are watching and they want to give and want to get involved, what do they need to do?
This is very easy. On our website, if you go to www.childrens.com/give, that's just how you do it.
Just online, easy. Any donation is appreciated, I'm sure.
Absolutely, and I'd invite everybody to come on down and take a look at Children's Medical Center because over the last few years we've just continued to grow, and I think people would be very surprised if they haven't been there in a while.
Sure, okay. All right, are you hosting a watch party for the premiere?
I will be hosting a watch party. Unfortunately, my family is from Boston, so they'll have to see the recorded version, but there'll be some cooking and some watching and lots of fun.
Okay, well, great. Well, it's fun to be a reality star, and because you are helping so many people in the process, it's a really good combination. Awesome. Thank you so much, Dr. Gulasarian, for being here. And again, season 2 of Children's Med Dallas, that premieres tomorrow at 6:30 right here on WFAA.
The nation's 5th largest pediatric hospital is about to get bigger. Major renovations going on at Children's Medical Center in Dallas. The expansion will cover 5 floors of the hospital and include adding nearly 50 additional beds, inpatient beds. Also, the Center for Cancer and Blood Disorders will expand to meet the needs of children requiring more prolonged treatment. The project will cost about $130 million.
Whooping cough cases are rising in parts of North Texas, and today Children's Medical Center confirmed that a child recently died there after getting the infection. The disease gets its name from the way the cough sounds, especially in children. It's a nasty bacterial infection, highly contagious, and children aren't the only ones susceptible. Fox 4's Emily Lopez reports many of these cases involve adults who have not been vaccinated.
That's with the pertussis.
Phyllis Lahan is not taking any chances. She's at the Dallas County Health Department getting vaccinated for pertussis or whooping cough. Lahan wants to avoid getting the bacterial infection and passing it on to her grandchildren.
I'd rather be safe than sorry, you know, about far as spreading anything or getting sick.
In fact, Dr. Jeffrey Kahn at Children's Medical Center says just within the last month, he's seen a spike in the number of cases.
We had a young infant who presented with respiratory difficulties, who was diagnosed with pertussis, who ultimately went on to respiratory failure and died because of pertussis.
Kahn says between April and May, there were 12 documented cases at Children's Medical Center. 11 were children. 7 out of the 11 children were less than 2 months old.
It's highly contagious, particularly to household contacts. And remember, infants are the most prone population.
Infants have not yet developed the immune system to fight the infection. This public service announcement aired in English and Spanish to warn parents about the dangers of the illness.
Well, it is scary, of course.
Olga Carroll and her husband have gone to great lengths to make sure both their girls are current on their shots.
We are up to date on their vaccines. We actually have a visit scheduled for 15 months checkup this week.
While many people get a series of shots as children to protect them from whooping cough, adults are not as vigilant about getting themselves to a doctor to get the vaccine, and that vaccination weakens over time.
I would recommend, and the CDC recommends, that parents of young children get their booster dose of pertussis vaccine.
All right, Emily Lopez is now to talk more about this. First, let's talk about the child who died. I don't know if we know child, infant, him or her. What do we know about this
About
child?
1 month old, but they stopped short of telling us anything more about the child because of privacy issues. They were able to tell us that the child died within the last month. That's it. That's all we know so far.
Okay, so that child, part of this increasing number of cases in Dallas County. Did you call around and see what else is going on in the surrounding counties?
Tarrant County, interestingly enough, they've had a decrease in the number of cases, so they've seen a downward spiral.
Right.
Now, in terms of any other counties that have had an increase, Denton County, exact opposite. They've seen a huge surge in the number of cases. It parallels or it mirrors what's going on in Dallas County. And one of the questions I asked the doctor is, why? Why are we seeing this?
Right.
He says it's just part of the natural fluctuation of the illness that happens from year to year. You see cases drop off, then you see the cases pick back up again.
As the Supreme Court ponders Obamacare, a North Texas hospital says they know the key to health care reform. Their answer next in Health. John.
All right. You know, the clock is ticking toward Thursday's expected Supreme Court ruling on President Obama's health care law. Now, since it took effect, the number of young adults with medical coverage skyrocketed by more than 3 million. The Affordable Care Act lets them stay on their parents' plan until they're 26. But, well, what happens if that law is struck down? Our medical reporter, Janet St. James, is here with what one major hospital believes the future of health care will be, and it started today.
That's right, and it started with kids, but this would go for adults too. So let's go over the scenarios. If the health care law stays the same, more people will have insurance, right? So more people will theoretically need regular doctors. If the Supreme Court strikes down the mandatory insurance provision, then the poor and uninsured will continue to use expensive emergency rooms for general care. Well, Children's Medical Center says the type of clinic it opened today may solve that problem either way. 1-year-old Aaliyah feels terrible. Her mother had been prepared to wait hours to see a doctor.
I'm having some primary care issues, so just stop by.
Where would you be if this place wasn't open for you today?
Emergency room.
My Children's Clinic is part of a major investment by Children's Medical Center Dallas to open neighborhood doctor's offices in areas lacking health care. This location is in Oak Cliff. The concept is called a medical home.
Instead of accessing our emergency room, staying up late at night, potentially missing days from school, and parents missing days from work, they'll have the opportunity to come to our office during the day or in the evening and make sure that all of their needs are met.
Children's hopes to have 16 clinics in underserved areas open by March of next year.
Her left eardrum is bulging and it's red. And this one too.
It took only a few minutes instead of hours to determine Aaliyah has 2 ear infections. The quick visit saved her family and the hospital time and money.
The start of summer, a good time to remind parents how incredibly dangerous it can be to leave their children in the car. A Dallas hospital tonight trying to drive home that point. NBC5's Andres Gutierrez explains.
4-year-old Lily Parsons always had a smile on her face, but last July the unthinkable happened.
The 4-year-old was found inside the family Suburban around 7 o'clock last night.
The little girl climbed into the family's unlocked car, got trapped inside and succumbed to the heat. Now her mother, Jody, is telling her story to prevent this from ever happening to other parents.
Until this happened to me, I really felt like it was not something that I had to worry about. And it turns out that I very much did have to worry about it.
Lily was one of the 33 children who died last year from heat stroke after being left in a hot vehicle.
To give you a sense of how quickly your car heats up after you park it, we decided to try it out for ourselves. But don't try this at home. The digital thermometer right now reads 94.3 degrees. For the next half hour, we'll be sitting inside this car and watching the temperature rise.
In just 3 minutes, our thermometer hits the triple digits.
So we're about 17 minutes in, and the temperatures have reached 113 degrees. I'm sweating profusely, as you could see, and that is one way that the body mechanism is able to cool down. And the 30 minutes are up. The final temperature reading 120 degrees. And you could imagine children's body heat up faster than adults, 5 times faster than adults, making them much more vulnerable to temperatures like these.
Children are very different. Children have a very large, what we call a surface area. They also don't dissipate heat very well.
Dallas's Children's Medical Center has partnered up with Safe Kids to get the word out.
Take action if you see an unattended child in a vehicle. That's a 911 call.
A serious warning for parents as temperatures start their yearly climb. In Dallas, Andres Gutierrez, NBC5.
And unfortunately, Texas has already seen 1 child die due to heat stroke this year.
Yesterday, the FDA posted a list of more than 1,200 clinics that had purchased recalled or contaminated drugs. That list included 8 in North Texas. Well, the agency took that list down after realizing it was not accurate. And today we're finding out just how wrong the FDA got it. Our medical reporter Janet St. James here with some details for us. Janet?
It is a mess, John, that's for sure. We realized immediately that the list had problems when we saw that the FDA had omitted 2 clinics that we knew had purchased products from the pharmacy. Today we found that the FDA got the information wrong in at least half of the cases here in North Texas and completely wrong in every case concerning kids.
The FDA got the list wrong.
Children's Medical Center is reassuring parents today that none of their patients got medicine potentially contaminated by the New England Compounding Center. A list released by the FDA yesterday showed Children's received 15 recalled drugs, including 2 of the potentially tainted steroids. That is wrong.
We want to make sure our families know that their children are not at risk from this, that we did not get that medicine. There's no risk that their child got that medicine here at Children's.
Children's Medical Center Legacy is also listed as receiving a recalled drug. That hospital did not receive any medicine from the problem pharmacy. Neither did our Children's House at Baylor, which was listed as having bought 3 drugs.
I would like to tell our patients not to worry. Baylor Healthcare System did not purchase any of the products in question.
North Texas Medical Center say after they're done calming patients, they'd like to know how the FDA could cause such panic. The Cosmetic and Maxillofacial Surgery Center in Dallas was also listed as having tainted steroid. That is incorrect, according to that clinic. The FDA told me a short time ago their list came directly from the New England Compounding Center. Federal officials are working now to correct the list and will repost when they are sure it is accurate. But the FDA so far today has not reached out to any of the North Texas clinics who say they got it wrong. At this point, what people need to know is that everyone who's been given injections of potentially contaminated steroids should have already been notified.